I'm Reverend Dr. Cameron D. Caesar. I've been herbalist since age 9. I served in the war in Vietnam as a physician's assistant. Let's see, I work at the chemistry department at UC Davis, where I've been teaching for 30 years and running general chemistry labs. I also work at Halent Laboratories, where I do safety testing of cannabis for both pesticides and mycotoxins, but also I analyze the cannabic profiles to find out which medicinal cannabinoids and terpenes are in it. And I'm also an ordained minister, which I've been for nearly 40 years, and I run a street ministry. The FDA has something called Title 40, and normally anything that goes in the human body or on the human body has to be tested for safety first before it's allowed to happen. After that, according to Title 40, it has to have appropriate labeling so that patients and customers can, be their own best advocate for what foods they want, with what concentrations of fats, calories, the amounts of medications that are in there. Now, since the federal government doesn't allow the EPA or the FDA to get involved with cannabis, that means here's an entire medicinal material that we have that is neither safe nor properly dosed for patient advocacy. And so this is what got me involved at Halent Laboratories. Something people don't think about, and that is that in the laboratory end of the business, I get a lot of clients who are making edibles, making tinctures, making external products, all these different materials. They're doing it without the proper guidance from the FDA. And so most of these products are not made anywhere near as well or as appropriately as what all of our sick patients require. When the fellows from Xternal showed up, and I instantly was able to recognize that they weren't like most of our clients, that they had carefully thought out the ingredients most people don't think about or don't talk about. They were concocting them together correctly to make these external compounds. The fact that the external folks recognize, for instance, that in many ways the non-psychoactive acid cannabinoids are probably more important than the neutral psychoactive ones, and that they were working on those specific products when I myself have spent the whole last year trying to get people to understand this, made me very excited that these folks already were way ahead of the game in terms of what patients needed, how they had to have it delivered in a safe, rational manner that they could use. And so that's when I got started working with Xternal, helping them where I could, or actually not helping, but assisting them where I could in improving their products so that the patients could have even better and finer medicinal remedies than they currently have available. One of the largest families of medicinal compounds on the planet that you find in plants are terpenes. They come in every shape, size, and have every imaginable medicinal property. Yes, some of them have toxic properties too, but they have a lot of medicinal properties. And as a result, what you find is herbalists all over the world use a wide variety of terpenes and terpenoids. Turns out that cannabinoids are a member of the terpene family. They're terpenoids. And again, as we're seeing now in all the medical and scientific research, there's an amazing number of different diseases and symptoms that they can treat. As far as cannabis receptors go, there's two that we know of for sure that we've isolated. CB1, which is mostly in the brain and affects mental and directly brain and neural issues. Then we also have CB2, which is nerve receptors that can be found throughout the body, handling more physical and systemic issues. It turns out in the case of cannabis, though, it has so many diverse medicinal compounds in, not all of them even use CB1 and CB2. For instance, the acid cannabinoids, we're beginning to realize, don't use CB1 and CB2 at all. They have an entirely different pathway that they use in the body to affect the things they do. We also know, for instance, now we've isolated that cannabinoids affect opiate receptors. We're pretty certain they affect serotonin receptors. And there are probably other receptors out there that we're going to discover that they also have effects on. So especially for instance, the neutral cannabinoids like THC, CBD, and others, what you're going to find is that this is why they have so many different effects on so many different diseases and symptoms, because they actually affect more than just the cannabinoid, the CB1 and CB2 receptor. As far as the acids go, the path length they're taking is very different. We know, for instance, that the acid cannabinoids, all of them are anti-inflammatory in nature, with rare exception. We don't know how effective they are, but the evidence we have to date shows that they can be as successful as certain mild steroids in for instance, treating inflammation. If you have a person, for instance, that's age 40 and over, they have, you know, arthritis or a lot of musculoskeletal injuries and pains, the the acid cannabinoids rather, they're not psychoactive, they won't get you high, and they're phenomenal at both pain and that inflammation, which means that here's an option for somebody to take a medicinal remedy that doesn't impair your ability to do your work during the day, but allows you to remove or reduce inflammation to the point where maybe you don't need more dangerous chemicals or pharmaceuticals like steroids, which of course can cause psychoses. There's no documented psychoses with cannabinoid acids. There's none. Of course, we see that with steroids. Look at pain. Say you want to use opiates, okay? Now you can have other kinds of psychoses that can occur with opiates. With NSAIDs, they cause bleeding in the stomach and other issues. It's amazing how many different diseases, disorders, and symptoms the wide variety of cannabinoids and other terpenes in cannabis can treat. So if you take a look, a lot of the standard allopathic pharmaceuticals that are on the market that we use for treating most diseases, a lot of them have serious drawbacks. The first of which is a lot of them can cause death. Okay, cannabis doesn't seem to be much chance of that. Let's look at the more common problems with them. Let's take CNS stimulants, caffeine, cocaine, methamphetamine, cause some serious antisocial behavior, right? To cause violence, other issues. Alcohol, an anesthetic, same issue, causes a lot of antisocial behavior and violence. Amphetamines can be, or not amphetamines, opiates. All the problems with the opiates for pain killing, not to mention the addiction factor, but above and beyond that, some of the other issues it can cause. And so these are all things that cannabis can handle. Take a look at steroids, right? Steroids are used for a lot of issues, including inflammation. And it turns out that the cannabinoid acids are good for that without the steroid psychoses. So my impression today, based on all the scientific and medical evidence we currently have and the rate and nature at which that evidence is building, tells me that probably cannabinoids are not the most potent treatment out there for a lot of these symptoms and disorders. But it certainly is a lot less dangerous than the other ones, to the degree where if you were to mix a tranquilizer with alcohol, you could die. You mix certain tranquilizers with certain opiates, we know famous actors that have died. You mix these different combinations together, people die. You can mix cannabinoids with most of those different compounds if you had to medically, without worry about it increasing the rate of heart or lung suppression or any of those other kind of fatal type of situations that can occur. That makes cannabinoids pretty amazing and very, very safe compared to other medicinal remedies.